Okay.
Hi, we have sitting here Claire and Marianne, and they are going to share a little bit about their story and a little bit of advice for any of you medical experts out there.
Yes. Expert or no expert. So my name is Claire, and I am a physical therapist, and I've been in practice for 20 years. I started a private practice 10 years ago in Orange County. And so through experience, I've learned that my patients need far more than exercise, and needed to find some way to help them heal from the inside out. Maybe they had inflammation, maybe they had diabetes, obesity was clearly an issue, or just being overweight. So I decided to seek a program upon recommendation actually of a consultant, but then I really looked beyond why I wanted to do it to help my patients as well. It's really important to help people through their health and wellness. So I became a health coach through the inspiration of a medical doctor who was doing it in Orange County that both Mary and I both know.
Yes.
So Marianne is go ahead and introduce yourself too, and then we'll talk about.
I'm Marianne Martin. I'm an endocrinologist, and I have been doing medicine for 10 years. And I have to tell you, I have been counseling patients on getting healthy, getting to a healthier BMI, controlling their blood pressure and cholesterol. I've been beating my head up against a wall because I will give them advice. They'll do it for a week, and then I see them in 3 months and everything is a mess again. So then they would say, well, can you create a nutrition program for me? No, I'm not a dietitian, can't do that. So when this literally fell into my lap because of a colleague of mine, I said, okay, I finally have like a secret recipe that I can now share with everybody of the easiest program ever. And so now, honestly, this is the conversation that I have. I see my patients, I go over their labs, and then I say, there is door number 1 and there's door number 2. Door number 1 is going to be, I can fix all of your issues, but it's going to take more medication. Door number 2 is you can fix your problems, but it's going to take a little work. You're going to have to change some things in your life, but you're going to have a coach there every step of the way. And if you're ready to do this, let's get you off your medication. And that's pretty much it. And I let them choose. And for me, like, I know which one I would choose, and so when somebody picks door number 1, I'm like, oh, really? And I'm like, it's all right, I'm gonna see you in 3 months. So I keep layering and layering, and eventually they see the light. And it may not be right away, but because I believe in it and they know I'm gonna talk about it next time, they're like, I know you're gonna tell me about this. I'm like, yes, I am, because I've seen too many people benefit from it, and I want the best for you. So it's been the biggest eye-opener for me, and it's been the biggest gift for my patients, and I'm so glad that I was able to find it.
And I'll add to that too. So I have a client, for example, I've been working with plantar fasciitis specifically, and we did tons of exercise, and she's working on other joints as well. And she was making some improvement, but after discussion about the health program, she decided to jump in, and that was in May. She's now down 50 pounds, and her foot pain's gone. She's walking straight, her hip pain's gone as well. And so her life has changed. So instead of healing her with just ankle pain, plantar fasciitis, we've completely empowered her to know how to take control of her health. And in fact, her family really struggles with obesity, and she's setting kind of a new map and a new plan for their family, which is really cool. So grandma's gotten healthy, because I work with seniors, and the whole family is rolling. Her grandson followed suit. And we hope to continue to roll that into her like circle of influence and friends, so she can continue to be healthy forever instead of treating it like a diet. This is really like a wellness program. So that's why I think it attracts medical professionals, clinicians to this field, because we feel like we can actually prevent illness, create health is probably the better word for it, and empower people to create, what they want and set their goals. So that's.
Thank you so much. Any questions we can add? That was beautiful.
That's awesome.
Thank you. Thank you both.